Now to another big story in North Texas, the flu. As we told you earlier in the newscast, at least 26 people have died in Dallas County this season from the flu. 3 people have died in Denton County and 2 in Tarrant County. Today we learned Collin County now has its first flu death. So joining us now, Dr. Crystal Foster from the Baylor Medical System. So how many people they've already received flu shots, we understand. What precautions, if we've got our flu shots and we're still scared, should we be taking?
So the biggest thing is washing your hands frequently, especially if you're going to the grocery store or out in public places, because even with the flu vaccine, if you got it less than 2 weeks ago, you still don't have full immunity. It takes 2 weeks for immunity to build up. So.
Okay, still not working yet. A number of flu cases, though, have taken this deadly turn. What are the signs that this is really, really serious and you need to get your tail to the emergency room?
So the flu kills by respiratory failure, so the biggest signs are shortness of breath and wheezing. If you are having a hard time breathing, don't waste your time. Just go straight to the emergency room.
Okay, now a lot of officials are worried now that school's back in session that this is going to spread even more rapidly. So what can parents do to make sure our kids are safe?
So biggest thing, if you haven't already, get them the flu shots. I mean, that's the biggest protection against the flu. Second thing, if you feel like your child is coming down with something, even if you're not sure what it is, keep your child home from school that day and take them to the doctor. It's better to get tested and treated early.
What about the difference between flu and allergies now? Because I know as temperatures were rising over the weekend, a lot of people started complaining about those allergies kicking in. Any suggestions to help them out?
Biggest thing, allergies and flu do have some similar symptoms. Runny nose, congestion, sometimes a lot of postnasal drip. The biggest distinction between the two, with the flu, you're going to have fever and body aches and probably really bad fatigue, feeling like you got hit by the train. Allergies don't typically cause such severe symptoms.
But they can last forever. I mean, I know people who have been sick for more than a month now at this point.
They can. And the biggest thing is rest and hydration. If you feel like it's allergies, antihistamine should work. Benadryl, your Claritin, Allegra, things that are over the counter should work.
If it's not, I mean, is there a chance that you hear that allergies can kick in even worse as you get older? Do people need to just take it very seriously if they have this lingering fatigue and sickness and it's not the flu?
Oh, certainly. Because it may not even be allergies. It may be something else like a pneumonia or a bronchitis that is still lingering. So
That's
yeah, regardless.
Always the worry. Okay. Anything else we need to know before we let you go? Because I know a lot of people are really scared, and I'm sure you don't want people living in fear.
No, we don't want people living in fear. But again, don't hesitate to get checked out, because the biggest thing with the flu, if we catch it early, we can treat it.
Okay, Dr. Crystal Foster, thank you very much. Another reminder, tomorrow we're going to answer your questions concerning the flu. Nurses will be live in studio for a special Fighting the Flu phone bank that starts at 4 o'clock and it runs until 6:30 tomorrow. And you can find out much more about flu symptoms, treatment, and vaccination locations online. Just head over to cbsdfw.com for more information.